Oh, good. Recording all of my uh, errors. uh, yeah, that is how I think about it sometimes. Provider resilience, body and mind. Let me first say that I'm with the Center for Innovative Practices, also this Child and Adolescent Behavioral Health Center of Excellence for the state of Ohio. Prior to being there, and I've been there for just about a decade now, I was in an agency down in Stark County, children's behavioral health care down there, and spent 25 years there, and was really hooked on this idea of resilience. And then at that point in my career, I was thinking about how do I make clients resilient so that they can withstand all the stuff that's going on. And I started my career in the early 90s, which means neuroscience was like brand new to be applied. The ACE study was just coming out, and everyone since then is benefiting from the fact that we are so much more informed about trauma and its impact and who we're dealing with, and things like secondary traumatic stress. And so it's not just the clients or the families, it's also how does it impact those people who are serving and treating these clients or patients or participants as well. So it also has somebody else's name on here, and I just want to give some credit to Holly Jones. She's not here, but she works with the Department of Developmental Disabilities, and she's also heavily into yoga, meditation, and self-care strategies. And we'll see some of her work in action towards the end of the slideshow. And we only have about 8 to 10 slides to get ourselves through. So let's just start working our way through it. You're a very small group, and so I really encourage you to unmute yourself and ask a question or make a comment or whatever it is you'd like to maybe in addition to something that we're talking about here. Feel free to do that. If you're particularly shy, you can also put it in the chat, and Nicole or Jamie will tell me if there's something I need to attend to there. But let's start with the neuroscience of stress, anxiety, burnout, and depression. So first of all, we'll think about ongoing stress. When we think about ongoing stress, I think about the fact that likely means there's an excess of cortisol flowing through our brains. And it's also related, unfortunately, to increased inflammation. And so many of you are on the medical side of things, and this idea that inflammation for some people is the core of all illnesses and all problems that the human body has. And so that's sort of like a bad connection, that stress and inflammation go hand in hand. When that happens, we have a weakened immune system, or it is chipping away at our immune system. And you can end up with cardiovascular problems, libido and fertility issues, definitely GI or belly issues. And then on our end of things, depression, anxiety, those sorts of things. Ongoing stress is really corrosive to our entire biological and emotional system. Conversely, however, physical or systemic diseases also lead to depression, which then you not only have to deal with the disease or illness itself, but the fact that we're worrying about it and struggling with it combines to make us feel very stressed out about those sorts of things. Sorry, I probably should have had the inflammation on there too, because that's really what I was talking about there, was that these two things really go hand in hand. If Holly were here with me, she would say this HPA axis activation, or this excess of cortisol, is like sirens going off in your brain, even if there's no current or actual threat there. And just those stress feelings can lead to the inflammation. So too much stress, definitely not a good thing. And there's such a thing as stress overload. Then you have some hyperactivity of your amygdala, hypoactivity in the hippocampus. Your serotonin is lower than it should be. And all of that leads to, unfortunately, a loss of or diminishing of executive functioning. So using the smart part of our brain and problem solving becomes more and more difficult. Eventually, what we want, or one thing that that can help, is that our hippocampus can send safety memories and messages to our cortex, which can sometimes help. But all of these things add up, and if you just glance at this, ongoing stress, inflammation in our bodies, overload of stress, it's not hard to see why workers in our fields are having trouble, because we're sort of faced with not only our own stress and our own inflammation, we're trying to deal with theirs. And so it just multiplies the amount of stress overload that our workers and we ourselves are exposed to. And if you wonder, is that true, or are my workers really having all of this stress and response to the stress as you're talking about it, Bobby? Let's put this up here. And this is a list, a very short list, frankly, of symptoms of stress. And so these are very common stress symptoms. And how many of these might be related to the stress issues that you have, or that your staff has? And sometimes they don't know that all of these things are exactly coupled with or tied to stress, but they really are. And you could Google on any one of them and get lots of information about the damage that sort of thing is doing to you, or it's the result of having that much stress all the time. That's causing you to behave in a way. For instance, I'm looking at minimizing on the bottom left. In order to feel like I can make it through the day, I may minimize any stress symptoms or things that I'm feeling, because I got to get through this day. I was a little stressed out a few minutes ago. It was 5 minutes to the hour. I wasn't logged in yet. I've had trouble logging in before, and so it's easy to slip into that. Especially when you are spread so thin and resources are low, and you're experiencing a lot of stress. And I don't know about you. As a matter of fact, I do know about you. I know that most people that I come in contact with talk about not feeling comfortable, having a lot of stress, feeling like, I hear this phrase a lot: I wish something would go right. And that's telling you that they feel that everything else is not going right. And so I just want to run through this list of symptoms, because not everybody includes them all when they think about helping people, right? We really do try to minimize our issues when we're trying to help others. So being hypervigilant, on the lookout, always on the lookout for something. And I'm a believer that basically you find what you're looking for. If you're thinking a lot about something, you're going to see examples of it, because your brain has that neural pathway already going about whatever it is you're worried about or stressed about. And so it's going to find those examples in your world. And so hypervigilance sometimes just leads us to a little circle where we can't quite get out of it. Because there often are no final solutions for whatever it is that's making you be hypervigilant. Feeling hopeless or hopelessness is another symptom of stress. And I have to say, I was always a very hopeful person. In the last couple of years, I'm struggling sometimes with that. And again, you really have to if you don't recognize it in yourself, it's hard to do anything about it. And so knowing that, yeah, that's a symptom that I fall into once in a while, it's beneficial just to just even know that. Sometimes it's an inability to embrace complexity, which is quite a struggle for those of us who use our brain to help other people. And suddenly we're like, ugh, I just can't take it all in right now. Um, and for those of you who do therapy work or clinical practice, uh, I'm guessing that most of you have had a moment or two in your career when you're like, oh, brother, what did they just say? I should be paying more attention. um, and it's not that you're bad at what you do. You know you aren't, but it's somehow all you can't hold everything at once. Uh, and what do you go to when you can't embrace complexity? What's the solution or thing that you can do? Um, and sometimes even the solutions aren't that helpful to us is the problem. So, but know that when you feel overwhelmed and have that inability to embrace complexity, for instance, you have to read a very technical report or some research out on something. And normally that would interest you and you'd be able to cruise through it. But suddenly it's like, I just can't take in anymore charts or numbers or things. Not uncommon. An inability to listen, that's a problem because for a lot of us, it's our job to listen to people. And so having an inability to stay focused on what you want to stay focused on. Jumping down to the next row, literally avoiding clients. So seeing that somebody's calling you, and now that we have smartphones and things announced on your screens, you can avoid them if you just don't want to talk to them in that moment. And hopefully they'll tell you what you need to know in the voicemail or whatever. But so I'm not talking about avoiding a client that you see in the grocery store. I'm talking about avoiding a client who's uh, usually has a right to be in touch with you and get responses, but you just can't deal with it at the moment. And hopefully you will do so as soon as you can. General anger or irritability, sort of chronic irritability, is a very common symptom of being stressed. You find yourself angry or irritable, not only at whatever it is that's really bothering you, some injustice, some oppression, something. You get general anger and irritability, and you can't seem to curb it. And sometimes you just have to step away. Being cynical about things. I think that's super common out there right now in our very polarized political environment. Both sides are very cynical about the other side, and it doesn't make for good, helpful conversations or solutions when you're stuck in cynicism. Having decision overload, feeling like, and that's not hard either in our roles, too many patients, too many clients, too many students, too many traumas, and you feel like I can't make another decision today. Or how about this, decision overload? You do fine at work, you cannot decide what to have for dinner. Anybody have that? You're just like, done. I'm done making decisions. Somebody will say, you want to go out? Sure, but I can't decide where we're going. You tell me, sort of thing. So the decision overload might impact you, even if you're managing it decently at work or with your duties. Sometimes it's in your personal life where that's allowed to sort of sprout, unfortunately. Having sleep issues, super common for all sorts of reasons. And it can go either way, right? You can sleep too much, feel exhausted all the time, and have trouble getting out of bed, or you can have sleeplessness and not be able to sleep. And maybe you wake early, or you can't go to sleep at night, those sorts of things. But any kind of sleep issue can be tied to stress. Fear itself, and lots of people are in fear right now with the way people are being treated by all sorts of forces in our world. and fearful for ourselves, fearful for our friends and for our children. It's woven into daily life, more so for those of us who are in positions of privilege, because we've been able to keep those things at bay, and suddenly it seems like it's creeping in on everyone. And so there are reasons to be fearful, and you don't want to ignore fears. You feel fear for a reason. You feel fear because something's threatening. And if you get that notice to your brain that you're fearful, that's when you want to do something about it. And sometimes we feel like we don't know what to do. It's overwhelming, or there is nothing to do at this moment, which helps with that next one, feeling exhausted, and not being able to shake it. And even if you try to sleep or you sleep extra, it doesn't solve the exhaustion. And so that's another sign that it's stress, not just simple lack of sleep. And then, of course, you either can develop physical ailments under a lot of stress, or whatever you have going on in you gets exacerbated because of the stress. And a lot of people want to separate sort of body and mind. And why should I, have more of these symptoms? Although it does remind me a little bit, and all you truly medical people out there, feel free to jump in here. But it reminds me a little bit of how I looked at COVID. And that was, if you got COVID, it tended to exacerbate any other physical illness or condition that you have. And it fires up things that were already problematic for you. And that's how I think of stress, that it increases any kind of distress or problems, physical or emotional, that you already have. And then the bottom line is, you talked about minimizing, but guilt, feeling a lot of guilt. And I want you to think about that for a second. What that guilt might be about, or how it might be triggered in you or people that you're working with. Maybe feeling guilt that you're not helping enough, or that you're not helping enough people, or that you're helping so many people that you're not there for your family, or that what about yourself? You feel guilty because you know what to do to take care of yourself, and yet you can't do it, or you can't follow through with it, or you do it for 3 days and then you're done for another month. So guilt over all sorts of things. Chronic pain, it's one of those pre-existing things that can be exacerbated by stress. And I already mentioned the COVID brain thing. So these are a lot of the most common stress symptoms. And I want you to think about 2 things. Number one, do you think we're missing any big category that isn't on this list? And the second question is, how many of these symptoms have you experienced in the last 30 days? So without telling us which ones are your Achilles heel, how many? From 0 to, what do I have on there? 16. 0 to 16 different things. How many do you think? And that number you could drop in the chat. Just in the last 30 days, how many symptoms have you personally experienced? All right. So whatever your symptoms are, whatever your experience with any of these symptoms, and whatever symptoms you're seeing in your workforce, whoever you're working with, for, or supervising, these are all things that we want to keep an eye out for. But just knowing that they're out there doesn't mean that you can do anything about them unless we think real clearly about what can be done for these sorts of things. And so I want us to think about solutions for a minute. How do we stay resilient through all of this that's going on, all of these stress responses, reactions in ourselves, in our workforce, and in our patients and clientele. And so what we're really looking for today is what's something we can do about it. It exists. And how do we deal with it? How do we encourage our workforce, that sort of thing. And so that's why this little series is called Provider Resilience, because we really have to think about how do we keep our workforce strong, or we won't have a workforce to do the very many things that we know need to happen out there. So if Holly were here with me, she would say one of the answers is yoga. And she has a lot to say about yoga. And yoga trainers, yoga practitioners, yoga instructors, they're true believers in this idea that your body holds the stress, right? And you need to move your body and do things in order to find some more balance. So yoga can help to balance hormones, including somebody medical pronounce that word for me. Norepinephrine. Did I get it close? Angela, come on, tell me.
Yeah, norepinephrine.
Thank you. GABA, GABA, serotonin, dopamine, and cortisol. Yoga can help balance all of those things. But the problem with yoga, you actually have to do it. And so just reading about it, just knowing it has an impact doesn't do it for you. You would have to develop some sort of consistent yoga practice. And yoga really does help you. It offers you a lot of different postures or asanas that you can use to move. For instance, I will tell you, I have a little bit of lower back pain. I do practice some yoga, usually 3 to 4 times a week, just in my basement. I'm not going to any classes or doing that, but I have a little online app that I use. And periodically during the day, if I'm feeling tense or stressed, I can just assume one of these postures that stretches out the part of my body that I'm feeling that stress in and get just a little physical relief in that moment. Yoga, because it typically works very closely with breathing, and you're to do motions that go along with breathing in or breathing out, really can help us sort of capture our breathing patterns and realize, for instance, that if you spend a lot of time at a computer and tend to do a lot of work doing that, it's one of the research studies says that when we're staring at computer screens, we simply don't breathe as deeply as we do when we're looking out at what we'll call the in real life world. And so breathing is a huge part of yoga and can help us with that. And catching your breath or realizing that you're not breathing as deeply and being able to take a big, deep breath let's just do it together. Everybody taking a nice deep breath. Hold it for a second or two, then blow it out slowly through your mouth. Two to four of those breaths, deep breath in, long, slow exhale, really is a signal to your brain that you're safe and you can calm down. So even if you're not feeling not calm, if it's more of a low level stress, that deep breathing just 2 or 3 times can shift how we're breathing and how we're feeling. And then finally, coupled with yoga practice is often some meditation. Whether people work it into the yoga class or practice, or whether after you do some yoga and deep breathing, you feel like you're able to meditate for a few minutes, they are very closely linked. So a meditative practice is also very helpful in terms of stress. So here's all the ways. Here's a long slide, and we'll start at the top here. These are all the different ways that yoga, breathing, and meditation help us. So that first one is that it helps increase our vagal tone and improve HRV. And I wish I could tell you what that HRV stood for. Anybody know? Because that would be a Holly word or a Holly acronym that I don't know.
That might be heart rate variability.
Thank you. I think you're right, Sarah Dugan. Thanks for jumping in. Heart rate variability. And I don't want to preach to the medical people because you already know this, but it turns out that having the same exact heartbeat at all times isn't what's healthiest for us. It's having some variability in our heart rate and not getting frozen or locked into one particular pattern. The next one is that your vagus nerve connects your autonomic functions in your body to your brainstem. And so a lot of this has to do with polyvagal theory and that sort of thing. And, for a while that seemed kind of mystical and unsure, but more and more research is backing it up or fine tuning that theory. And so that vagus nerve is important, and it is feeding all your body information into your brain. Another way that these practices help is that you can learn to regulate your breathing, breathe more deeply, breathe for a certain number of minutes. There's a breathing pattern that helps decrease anxiety and panic attacks. And so literally just breathing can have a very positive impact on what's going on. These practices also help you with your digestion and helps you for your mind to be a little clearer to process experiences, to be able to look at them without feeling so much stress or overwhelm. 80 to 90 afferent fibers. What they're talking about is how do the messages get sent from the body to the brain? And we now know that there's just all these fibers that are doing it, and it's not any one singular route, but it's really, they help the connectivity and the flow of information. And again, when I say they, I'm talking about these practices of self-care. Low vagal tone, by the way, so not strengthening it, not doing those practices, are very correlated with depression, anxiety, and chronic pain. So the very things that you wish you could let go of or get over or manage, when you don't do these things to take care of your body, your breathing, and your brain, your meditative self or state, you're likely to increase these problematic areas. And doing these activities can reduce cortisol, salivary, I think I got that one right, salivary cortisol. And doing these practices can increase dopamine, and you really want the dopamine. You want, and sometimes I talk about providers get dopamine on a relatively frequent basis because dopamine can be shared across people. And if you're feeling good about something, the person with you is likely to be feeling good about it. And when we're in the helping professions, when we feel like we've helped somebody, we get a shot of dopamine. And when they feel like they were important enough and seen enough to be helped, they get a shot of dopamine. So I love that concept of the double shot of dopamine. It also has an impact on GABA, serotonin, and they're the BDFN. Anybody want to jump in and tell me what they think that is? That's the acronym I don't recall here, although I might have it down.
Brain-derived neurotrophic factor.
Thank you. Thank you, Sarah. So appreciate you. And let's see, I think I have one more down here. Finally, what we really don't want is brain inflammation, because brain inflammation is totally linked to depression, and it has very strong correlations with burnout, which is also linked with depression. And at least back in, so this is a little bit older data, but back in 2012, there was a study that came out that in the United States, the fastest growing psychological condition that people were seeing was anxiety. And that it was, I'm not sure that it slowed down, but I don't know, frankly, as we get better and better at pulling things apart and figuring out what's contributing to what, if anxiety is still the current top hitter, but it certainly was in 2012, before a pandemic or some of this disrest we're seeing right now. All right, all that to say, these things help. They literally have been proven to manage or decrease the negative things I just talked about and increase the positive things. And they're not, they are available to anyone. You do not have to pay for a $500 yoga series. You can find free versions of it online or just learn a few postures and make up your own practices. You do not have to, all of these things are available to you. Taking a 60-second break and having 3 nice long breaths during that can be restorative. And finally, meditation. While some people struggle with meditation, well, actually, everyone struggles with meditation. That's kind of the point. We can't control our brains. But what I want to say is that some people have struggled with even the concept of meditation in the past, thinking that it was it was an Eastern thing. It was very religious. There were lots of reasons that people would push back on it. And I feel that we can thank Marsha Linehan and DBT for separating it and making it more of a science, not attached to any particular religion. That we see so much meditation now in our practices, and it's not quite as demonized as it had been in the past. So these are all things that you have access to, that your patients have access to. And but since we're talking about workforce resilience, these are all things that we should be encouraging in our workforce. Let me jump to here. So, as I mentioned, I originally did this presentation with a woman named Holly Jones, and she's with DD. And this is a screenshot from the Department of Developmental Disabilities. And but anyone can visit it, and they have on there something called the Wellness Project. And I love that she put in here that you can jump on that website. And are you a reader? Do you want to read something about it? Would you like to listen to something about it? Would you like to watch a video about it? It even says taste there. Maybe she's recommending that you taste certain things, explore options, experience things. These are all, there's all things that talk to you about wellness and how do we help ourselves out? How do we share wellness practices with others, et cetera. And so anybody can jump on there and take a look at the Wellness Project. It really is a collection of resources and self-care practices that will support and enhance your wellness and your resilience. I am unsure whether other state departments have followed Holly's lead there and whether there are more on different websites, but I do know that this one's available and frequently send people to check out what do they have new out there. And so this is just a different shot of this. This is an example of experiencing the Wellness Project, and they're video clips of nature and nature sounds, and often very soothing or calming to people. So they're things that are related to being healthy. You may have other ways, and you may have other practices that help you center yourself and ground yourself. But what we want to move from is an emergency response to a more of a practice-based response, where you do something with some consistency and regularity is more likely to help you decrease all that inflammation and manage your negative emotions and outcomes from the amount of stress that you're under, and your workers as well. And that added to this, and Jamie, I know I owe you these PowerPoints, and I swear I'm going to get them to you so people can have them. There's a whole list of references and resources attached to this one. And that'll be a handout available to you through this program once I connect with Jamie again. But remember, your yoga menu of tools, your mindfulness, your breathing, your stretching, it's all supporting your nervous system. It's not like you just do this, like you do sit-ups to strengthen your core muscles. It's very specific. But yoga is really about helping your brain and your nervous system and your body be aligned and as healthy and strong as we can possibly make it. And that is the last slide. I'm happy to talk about anything, answer any questions, or you could jump in with what works for you.